Well, here he is, Dr. Jeff Wixson, president of Novometrics Research, and a guy that I've had an opportunity to chat with a number of times and even meet up with in person. Hi, Jeff. Thanks so much for joining us.
Hi, Mike. Thanks for having me.
Well, this is right in your world. And so let's tee up for people who you are and what you do. Explain that to us, if you don't mind, Doc.
Sure. So by training, I've got 3 doctorates. I'm a veterinarian. I have a doctorate in pathology with specialization in avian or bird pathology. And I have a PhD in epidemiology, specializing in zoonotic infections. So infections that come from animals to people. I worked for nearly 20 years in the Public Health Agency of Canada, created their foodborne, waterborne, and zoonotic disease epidemiology unit on the human side. Cross-appointed to the University of Guelph, where I was a professor, still an adjunct professor. I'm now president of Novometrics Research, which I have been since the early 90s. What we do is we link networks together to create solutions to wicked problems. And obviously avian influenza and the ostrich issue is a good example of that, or a bad example, however you look at it.
And enter us into your life to probe you with all these questions about that, because you are the guy, certainly, that would understand this better than anybody. Outbreak response is something that we've had lengthy discussions about, and it's a fascinating process that I think our government and every government in the world needs to really embrace. And we'll go into that, I'm sure, on another day at greater length. But I wanted to ask you, first of all, what's the specific virus or pathogen that was discovered in the outbreak?
So it's referred by a bunch of names, but I call it HPAI, highly pathogenic avian influenza. So there are lots of influenzas in people and pigs and birds and so on. Lots are mild. Every once in a while we get a really bad one, virulent one, and this one in poultry and in wild birds and wild mammals has been moving up and down North America for the last more than a decade now, and kills domestic poultry like a plague, and it does the same thing for wild birds.
And I think the part of the concern is that it'll make the transition from the bird species that it's infecting and make the crossover, not only harming farming and doing such devastation to that industry, but also make the leap to humans.
Yeah, and so it's one of these things where it could be, and it already has, of course, got into humans, causing mild infection in most cases in North America, but some severe infection. And in other parts of the world, this specific strain has actually caused significant mortality percentage-wise, but in small numbers. So it's one of these things where, and this is the kind of thing that I think it's really important for the public who's interested to understand how this works, so we can start to keep our governments accountable. So it's one of these things where this thing could kind of smolder along and then disappear and not get into people, and nothing bad might happen. On the other hand, it could turn into a form that causes serious human mortality, and it could be really serious. It could certainly make COVID look very mild. It can cause that. Haven't seen that kind of mortality in 25% mortality and so on in North America, but we have seen it in other parts of the world in small numbers. So it's one of these things. Okay, everybody, what do you do when you have a thing which might blow over or might be utterly catastrophic?
It's a very difficult precipice to be at, is it not?
Well, it's complicated in a sense, and it also means let's not panic on either side. Like, let's not be dismissive that it's all just going to go away and don't worry about it. Or, oh my God, the sky is falling. Right? I don't mean to be dismissive.
No, but there has to be a calm on both sides. That
totally
would make sense to me.
Totally.
Do you think that the culling then might have been undue? Or, I mean, a lot of the response to this seemed to be that the government was taking rash action, that they were scaring farmers in big ways, and even the public a little bit by doing this. Was this a good response to this potential outbreak?
So you mean the ostrich farm one?
The ostrich culling, yeah.
Yeah, yeah. So yeah, I would say based on the information that I have now, and that includes, reviewing the literature and talking to some really credentialed Canadian and global experts. They're the birds almost certainly, these ostriches almost certainly had herd immunity. Almost certainly they were not shedding, highly pathogenic avian influenza in any clinically significant level. That's based on the fact that they, and I'm sure you've heard of this and people would have heard this in the news, no disease for months in these birds, no clinical signs. And actually testing of egg yolks from these birds by Steve Pellick at UBC showing that they have antibodies. And then the third kind of thing is CFIA's absolute refusal, prohibition, in fact, of any further testing. So I'm going, no, this cull makes no sense. What makes sense is to bring the right people to the table, along with people from CFIA, figure out what's actually going on, look at the data, do proper testing, and then based on that testing, decide on the right interventions. Likely a proper intervention would have simply been to maintain quarantine and use this as an experimental site to examine how to manage this and birds that have gone through this natural immunity process. So I'd say no, it made absolutely no public health or animal health sense to me.
Well, and I think it was a bit of a public, a PR nightmare in the sense that it made Canadians think, oh, wait a minute, we're just taking really evasive action right away every time something frightens us. And I think as Canadians, we would prefer to have, or anybody, I think, it doesn't matter if you're Canadian, where you are in the world, what you want is your government to present you with the realities, present you with the options they're working with, give us an idea of where exactly this is all headed, and then start to take action based on expert input.
Totally.
And we don't see that in this case, I don't think.
No, and very importantly, as part of that, independent expert input, right? Not simply CFIA scientists, right? Because they actually don't have the skills or the context, and they're not independent. They can't possibly be independent on this. So
also, it feels to me like the reception from the farming community, certainly in the ostrich farming community, would have been a lot, I guess, a little bit more at least intact with working with the government if they were given some sort of understanding of what was going on and not just an instant culling like they were checking it off on a list.
Totally. No, so it's really very simple. And this, for me, this comes from quite a few years of actually doing outbreak response, like Walkerton, being heavily involved in that. A very normal, intelligent thing to do would be for the leadership of the outbreak response to sit down with the farmers and others and go, okay, what's going on here and how can we work together? My boss, when I was with the Public Health Agency, an excellent guy named Paul Sockett, he said to me, and he had done multiple outbreak response in Canada and the UK where he's from. He said, Jeff, once you lose the community, you lose the outbreak. It's that simple. You can't actually resolve it
without that interaction and assistance from within. If you've got resistance, then you've lost the outbreak entirely, it seems.
Totally. You can't. You need people. Yeah, you need people to be involved, and that's what we're seeing in the commercial poultry industry, which is different from ostriches, obviously, but the principles are the same. And I can tell you, because I talk to lots of actual poultry farmers, not simply the poultry boards, which are in a different position. I'm not trying to disparage the boards, but they're in a different position. When you talk to actual poultry farmers, they're highly suspicious of what CFIA is doing. As a result, they start to become very suspicious of their own boards. Because if the boards aren't involved, right?
If the boards are letting them get access to these farms and this livestock, then they become part of the suspicion as well.
Totally. And I've had a number of farmers ask me, Jeff, if we ever had another outbreak of mortality on our farm, is there a way to get them tested where we wouldn't have to go to CFIA at all?
That was my question to you. Is there a private way to go about this that would be acceptable to the government?
Well, and so acceptable is an interesting word in this context. What I understand, and we haven't been involved in doing this, but in looking at the research doing some research on this, it looks as though there are ways that legally farmers could have their birds tested anonymously. We're looking and it's sort of at the point where if that kind of stuff isn't I mean, the ideal system is we get everybody working together, get a proper outbreak response in place, have CFIA be part of that, not running it, because CFIA doesn't, not only do they not know how to do outbreak response, they don't even have a mandate to do outbreak response, which is shocking, but that's true. They have a mandate to stamp out. They don't have a mandate to figure out what's actually the disease involved.
So they literally could be stomping on the evidence required to prevent future outbreaks by just doing their job the way that it's outlined now.
By following their interpretation of rules and norms, which are frankly outdated, they could, they are stomping out all over the whole thing, right? It's a major problem.
So Jeff, where does it go from here then? If that's their mandate and it's not the solution, how do we get the right solution in front of the government and get that implemented?
Well, so this speaks to the whole issue of how you do proper outbreak response and it's nuanced and there's different layers, right? So I can tell you what we've done, and there are many people in Canada involved in HPAI outbreak response, but very few who actually understand proper outbreak response, right? So, and I'm not bragging. I did a 2-year internship with the public health agency where we actually learned through mentorship how to run proper outbreaks, right? And there are very few people who know how to do that. It's a very limited. So there's a lot of people out there going, well, we should try this, we should try that. It's like, whoa. So
there has to be a methodology.
Totally.
Before you even get to that place, I think.
Or you will simply circle around and around and around in chaos. And that's without people even understanding what's the source of the chaos, right?
Right.
And so there's this well-established best practices for doing this. We call it the pillars of outbreak response. So I don't need to go in detail, but there is maybe another time, but there's a.
Oh, I would love to do this in depth, because I think it's important that people understand that there are people out there that when a COVID hits or when we are faced with avian flu, that there is a science and a methodology and a process that can be done that reduces it and brings us to safety quickly.
Totally. And so for the public, what we're advocating is that, and this is why it's really helpful to be on this kind of show, that the public step by step starts to understand how you actually do this. And then they can see, instead of randomly saying, oh, that doesn't look right, or that doesn't look right, or that those people are clearly idiots, or those people are really brilliant. We have a common language based on best practice, and we can talk about it. And then the public can be involved and go, no, this clearly is wrong based on this series of papers which have already been published, which show what to do, right? So
right.
So that's what we've been doing.
That is one phase to this, and so now how? Okay, I hate to ask this question, Jeff. Sometimes I go a little off the rails here.
Yeah.
Why don't we have this in place already with in our healthcare system and in these various industries where we can have these outbreaks? Why is it that we don't have this at the moment?
Well, that's a good question. Excuse me. And so I would say, first of all, in public health, at the federal, provincial, and local levels, actually this is in place. People know how to do this, and they do it regularly in public health for things like, you will have seen there might be an outbreak of E. coli in hamburger, right? That there are very good people at the federal, provincial, and the local level, like Murray McQuaig, who is in Walkerton, who know what to do, right? And so at that level, in public health, it's well established. When we hit COVID, all of that was thrown out the window. Now, why? Partly everyone's a deer in the headlights, partly political, partly money, right? There's a whole bunch of incentives, and partly just, it was so big, everyone kind of just went crazy. And then I think it's very fair to say certain people stepped in and gamed the system, right?
Yeah, I think that's where having an outbreak response at the onset, dealing with international input, dealing with governmental implementation of programs and safety nets and things like that, maybe should have come from a group in this country. Please, let's make one that is ready for any outbreak with a response system.
Totally. Then that's what's needed. So having talked to many people across the country in this, and people outside of the country, and talked to the chief veterinarian of Canada, deputy chief, similar kind of stuff in Ontario, similar kind of stuff in BC, and doing analysis, we concluded this outbreak response for HPAI generally is completely off the rails. We're not the first to say it. I think it was CBC did a thing and they said it was utterly chaotic. So it is chaotic what's happening. And
I envision these guys in hazmat suits coming over the hill at an ostrich farm, already with mallets in their hands. I mean, that was the way that it was presented, but I don't think that was far off the feeling that was left behind, that the government just can't come in and stomp your entire farm.
Totally. I think that's what, in that instance, that is what happened. And so what we've done is we've said, okay, now, because there is actually, not only does CFIA not have a mandate to do animal disease outbreak response, it turns out no one in Canada has a mandate to do that at the national level. And so we talked to it's just odd, right? It's like, what?
Yeah.
And so
I think every Canadian would assume there is a science lab someplace and a war room ready to protect us from these outbreak scenarios, and really there's just not.
There isn't. There's pieces of it scattered all over. So what our organization, Novometrics Research, we're a social enterprise, I don't know, a couple of weeks ago, we just stepped in and said, we're now creating that. Okay, so nationally, we're creating that. With Scott Anderson, who is the MP for Vernon, where the ostriches are.
Right.
He sent a letter to the Minister of Agriculture and the Prime Minister saying, because of everything I've talked about here, now Novometrics Research, through our network process, so it's not like Novometrics is going to own this. We're more like a facilitator, right, of the process, or a secretariat or something. We're now doing this. So and it turns out that's fully legal and reasonably normal in terms of political science. It's called an organic mandate. So if there's nobody doing it, and if you have the skills, and right, it's very reasonable to simply step in and do that. So
well, I'm glad to hear that so now what's the next steps for you guys? Off to Ottawa?
Off to Ottawa today. I'm driving up. We have a meeting of, I would say, grassroots and professional stakeholders in Ottawa that are meeting about kind of next stages. And I'm meeting with some politicians up there, and there's a lot of interest now in, okay, this actually would make sense. How would we fund this out? We have initial sponsorship for this, and we're reaching out to various corporate sponsorship. It turns out in the agricultural industry, and I know some people are very critical of pharma, and I get it, right? There are certain things definitely that pharma has done that are not the best. On the other hand, they're part of the ecosystem, and they have resources and expertise to help with this kind of stuff. So they're now they have a very strong incentive to want to fix up this craziness as well. So and a lot of times this gets missed because people go, oh, I would never work with pharma. I would never. No. You got to actually bring the people together, and the process we use to do that, you've heard me talk about it, community network integration, CNI, which is the kind of the operating system to bring all these people together. So that's what we're doing.
It makes sense to me that the best in category around you, regardless of what the stereotyped, I guess, feeling that we have in our mind toward that industry. You're right; they're part of the ecosystem, and I think that the backlash to that might be, oh yeah, but they're looking for the next outbreak because that's where they make all their money. But the reality is they have mandates to prevent, to be at the gearhead of this to make sure that outbreaks don't occur.
And it's not even like some totally get what we're talking about. Some are purely just in it for the buck. But my experience is I've worked a lot with people in animal pharma. They're generally actually really good people, and they're smart, and they don't want to destroy their brand by aligning themselves with a thing like this CFIA ostrich and the general CFI process. They don't want to align themselves to that. And the fact is, many people have problems with what CFIA has done because they have so much power. They run as a general statement, not the people within the organization, but as an organization and as a senior management team running it, they run roughshod over many, many people in this ecosystem. But people are terrified to go after them because they don't want to have their business destroyed or their brand destroyed. So,
well, I have great news. I am not raising poultry or any wildlife or any sort of livestock at all. And so I will say, please, we need to look into what this group is doing properly and make sure that our government has the right planning strategies in place for this sort of thing. And Jeff, to be honest with you, and having talked to you a number of times now, your mission is consistent. It seems to go adjacent to almost any outbreak scenario that you have because it's based on common sense and process and information. And I really hope that your trip to Ottawa is an amazing success among the group that you're working with, and that you're elevated in Ottawa to get this thing going across the nation. Is there any place you'd recommend people go to find out more about what you do and how you guys go about it?
So we have a website, www.novometricsinc.com. It has some information there. Things are moving so fast now. We're trying to keep it up to date. If people want to email me, they're very welcome to email me directly. Mike, you can just put my email in wherever you put it. I'm happy.
Certainly, take a look in the description. If you need to reach out to Dr. Jeff Wixson, Novometrics, I would encourage you to do so. If there's something you think you can contribute, some line of thinking that you think aligns, or you have any questions, because I have asked you some pretty basic questions today that have led to some very interesting answers. So I would imagine you'd be wide open to all of them. Jeff, thank you so much for your time today and giving us an understanding of just how crazy this was, frankly.
And is and continues to be. And so, thanks very much, Mike. Thanks to all your listeners. Really appreciate it. Thank you.
All right. Well, we'll catch you next time. And thank you so much for being with us. This story will continue. We will continue to follow it and reach out to the right experts like Jeff. In the meantime, I thank you for joining us. Subscribe, tell a friend, share it around. Go ahead, make a comment. I know this is not the right color for me. That's okay. Let me know. We'll see you soon.
Okay. Thank you.